Welcome, welcome. I think we're going to go ahead and get started. We've got lots of great information, so let's dive in. My name is Sierra Bragan, and I'm the owner and founder of Miami Mom Collective. And Miami Mom Collective is Miami's premier parenting resource. So we host events for local moms and families, as well as produce resources that are helpful for families and for moms. We have an amazing team of over 60 women who are producing content for us and helping us with events. So local moms who are just have a heart to serve other local moms. So you can find us on all the social channels, Miami Mom Collective, and our website is Miami Mom Collective. If we can ever serve you, we're here to help. So I am thrilled because this has been one series that I have just personally become so invested in. I've learned so much. We've been doing this for nearly a year now, which is crazy to believe. It was a great pivot that UHealth Jackson Children's Care did during COVID, and it has since become just regular monthly since then. And so we just love that you guys are joining us. I know many of you have probably joined us before, or if it's your first time, welcome. But we typically have people joining us from other countries all over America as well, and of course in Miami. So thank you for being here. And I just want to take a minute to share with you those who are in Miami. I want to draw your attention to the amazing services that are available to you from UHealth Jackson Children's Care. So you may not know, but the emergency room at Holtz Children's Hospital, as well as Jackson North, are available 24/7. And the Holtz Children's Hospital offers a 24-hour kids-only emergency room. So you're going to get great hospitals that are staffed with board-certified pediatric emergency medicine specialists. So parents and children are getting access to every pediatric subspecialist at Holtz Children's Hospital from the University of Miami system, as well as Jackson Health System. So you really are going to get the best care. And at Holtz as well, the doctors and the nurses are certified in pediatric advanced life support. So I hope no one has a need for an emergency room, but if you do, please know that the Holtz Children's Hospital, as well as Jackson North, are available to you 24/7. So without further ado, I'm excited to introduce you to tonight's special guest, Dr. Evelyn Benitez. She is the Associate Chief of Psychology at Jackson Behavioral Health Hospital, as well as a licensed clinical psychologist and certified addiction professional. So those of you listening, you will not believe her bio is so extensive, and just her experience is so well-rounded. We're going to have so many questions for her tonight. We're going to keep it on the topic of sibling rivalry, but she's been a part of the Jackson Health System for over 20 years and in the mental health care field for over 3 decades. So imagine the wealth of information that she has. She originally worked as a mental health therapist and became a certified addiction professional. And her interest in addiction, how it affects children and families, that is what prompted her to specialize in children and families as a clinical psychologist. So her interests are trauma, ADHD, autism, addiction, chronic illness, and crisis intervention due to injury and accidents or the loss of a loved one. So very specific, particular skill set that she has, but also just a broad range of experience. So she also has administrative and management expertise and has taken on leadership roles in the Department of Psychology, as well as overseeing the Jackson Behavioral Health Outpatient Services as part of the administrative leadership team. She's also been involved in community service and so many projects there. Currently, I do want to tell you that she is the Associate Chief of Psychology and the Director of Postdoctoral Residency Training. So she is working with supervising the psychology interns, the residents. She's also doing lectures for child psychology trainees, for the psychiatric fellows, for the the psychology residents. So I don't know how she has time, but in her other time, she's also teaching others, which is amazing. So, so much that she is doing. She was actually, this is an interesting fact, she was most recently selected to be the program supervisor for the GATE program, which is also known as the Juvenile Weapon Offenders Program. This is something I've just learned. So this is a countywide intervention program affiliated with Jackson Health System, and it's focused on gun violence prevention. Amazing work that you're doing there. So Dr. Benitez is also a member of the Florida Alcohol and Drug Association since 1990, as well as a member of the American Psychological Association. Excuse me. Wow, it's a mouthful because you are incredibly qualified and so just the experience. You have a wealth of information to share with us tonight. So, Dr. Benitez, thank you for spending your evening with us.
Thank you for that welcome. I appreciate it. And I'm really happy and pleased to be here, hoping to share some of the information that's so needed about sibling rivalry.
Yes, yes, it is. So I am a sibling. I have an older brother who's, we're old adults now, but I remember some sibling rivalry when we were kids, and I'm the mother of 3 children now. So I have a 4-year-old, a 2-year-old, and a 4-month-old. So I know that this is starting to happen in our home and will continue. So I want these skills. So let's dive right in and tell us, what is
So sibling rivalry, we've got a little bit of connection difficulty, but I'll go into, hi, you're back. What is sibling rivalry? I don't really need to explain it, but I want to make sure we're in the right track, the same track. And it's anything to do with bickering, tattletaling. It starts very small like that to then being in constant arguing, and even sometimes to the point of violent and physical fighting, and voicing being jealous or envious of some of the siblings. So it can take different roles. But those are the ones that are mainly known, and they have different degrees.
Tell me, is it normal? And like, what are some common causes?
That's a good question. It's normal because it happens in all families. It happens. I was watching a video the other day, and there was 2 little twins. They were at least even just getting ready to learn how to sit up, right? And there was a room full of toys, and they were fighting over an empty box of toys, back and forth. So you're very familiar with that. They wanted the box that each other wanted, and they were pulling it back, and there were these little tiny things that were just you can see the wobbling still. It can start that early, to be seen, that competition of wanting what you have. So it's really normal as soon as there's another sibling in the house. That's what I can say. And it could be blood relative, it could be foster kids, adoptive kids. Anytime there's kids within that range that are siblings in the household becomes something of a rivalry. Now, it could become from different ranges. It could be very, we pay a lot of attention to sibling rivalry because this is our as a parent, we are like, oh, it would be so nice to have another child so that they can play easily and harmoniously. And we have all these warm thoughts and dreams. And then all of a sudden you hear, Mom, he hit me. Oh, no, I didn't hit her. Yes, you did. You're a liar. And so then all of a sudden you go, oh, no, you see the parent just hitting their shoulder. There it goes again, So we're all used to it. I think, so what I mean by normal, it's very common. Now there's different ranges, and there's some kids that get along really well. There's some kids that go through these stages, and then there's others that never outgrow these stages, and it's a lifelong detriment to their relationship and to even themselves in terms of how they relate to others, because it is affecting them. So that's kind of where we're at. In terms of what may be the causes, many causes is needing attention, seeking attention. It's a very common thing. So what they're asking of us is they want their attention, so they're competing for parents' attention. They're also just individuality. They want to be able to be on their own. So there's sometimes what you'll see is kids looking for being on their own. So they don't want to be with the other child because they're either too young or there's a different temperament. Also power. They want to have a sense of power and control. Again, all these are natural instincts of kids, but they do affect how it unfolds in the household and how we as parents respond to it.
Yeah, No, that's good. I've definitely seen that in my home since the third baby arrived. I'm noticing more and more with the two, and I think I really see it when they need that attention. So, talk to us about, are there any do's and don'ts that could be helpful in reducing conflict and the negative effects of sibling rivalry? Like you talked about, it could go with them for years. Like, how could we reduce the negative effects?
Yeah, and and I before I went there, I forgot to say, that it's also common for kids just because they're bored to pick on the other one. So I think you've seen that too, even when they're young. I forgot to say that because of they're bored. So it's not always because they're competing. Some of them are bored. Some of them don't know how to ask to play. So they just figure out, how do I get their attention? So they do it the wrong way, and that's where there's a conflict because the other one is playing with their puzzle, and then they want to join. So just going a little bit back with that one, what we don't realize is how is it being caused? And so, because we usually come in after the fact, when they're the screaming, the crying, or the hitting, that's when we come in. So we sometimes don't really pinpoint that.
That's great.
So I think you were asking me the next question. I forgot that the question you just finished asking.
Yeah, do's and don'ts. Yeah, do's and don'ts that would be helpful in reducing the conflicts or the negative effects.
Okay. So let's say do's and don'ts. Really, I think a lot of parents are, we're all trained to say, don't get involved. Don't get involved if there's sibling rivalry. There's precaution with that. I think we need to know when to get involved, because if we get involved too early, we're ruining their ability to really learn how to problem solve together. But if we don't get involved in the intensity and the name calling and even physical outbursts becomes out of control, that's when we do get involved, but it's gotten to being too frequent, too much. And so they really have now no concept of what are some of the limits. So we really need to go, I obviously said two extremes, but we really need to know when to get involved. And when we do get involved, I read in one of the articles on sibling rivalry or techniques that they say it's kind of the red light, yellow light, and green light. Well, green light is what's minimal. You don't need to worry. You're hearing them kind of going back and forth, fighting about something, a little bit of the yelling. You don't get involved. You let them work it out. Then it starts getting into the more of the yellow light, where you see the loud voices, some cursing or name calling and things like that, and even probably pushing or something. You start saying, making yourself kind of the yellow light. You're yielding. You're not going all the way in, but you're going in enough to say, is everything okay? So that you can mention that there's something going on. Now, obviously, from orange to red goes when you hear already that you have to intervene. So those are things that I think it's so important for parents to know when, because a lot of parents say they'll figure it out, let them beat themselves up and they'll figure it out. And I think that's a concept that many of us have. And I think we need to really educate that we need to know when to stop, because if not, they won't learn their skills. Another do's is to be aware of when it's happening. We need to be aware as parents, what might be causing these things. Is it that, what I was saying earlier, are they bored? Try to figure out in terms of do's is, are we spending enough time with each of the children? I think a lot of times we tend to only get involved when we hear they're screaming, they're not getting along, and we're not promoting the positive behaviors. Right. For example, they're sharing, and you happen to catch them sharing, and you just smile inside and just walk away. But when you catch them grabbing something, that's when we get involved. So what we just showed them is, we're only going to get mom's attention is when we do something bad, right? And it's so normal for us to do that. It's like, that's because right. We're, I had a parent that told me, I lay it real quiet. When I see them like this, I don't want to say a word because this is peaceful for me. I'm afraid to say something. And I understand that fully, but I also say to them,
I don't want to jinx it.
Yeah. At it. Yeah, they don't want to jinx it and all that stuff. So what I tell them is, we need to, enjoy the peacefulness, but also we want to promote that good attribute in terms of sharing or helping, or someone fell, you said, oh, you cared for her so much, or him, because that's what you want to have them hearing about themselves, versus, I can't believe you just hit your sister. Can't believe you just grabbed that from your brother. It's his birthday, and all you're hearing is how bad it is. And so,
Right.
and it's very common.
Right.
That's why I'm continuing to say that, so that no one feels terrible. Just, it's more of awareness. And I think that's will be very helpful. Once we become aware of these are some of our patterns, we could at least try to stop them, and change them.
That's right. Oh, that's very good. Such good reminders. It's like in that moment, you kind of, parents, I don't know, speaking for myself, but I naturally go into the solve the problem issue, and you can kind of forget some of these strategies. So let's talk about one that I've heard. So I've heard one of the prevention strategies for conflict is to dedicate one-on-one time to each child. However, many parents, myself included, at times feel overwhelmed with responsibilities, and I find it hard. I can get to the end of the day and I'm like, did I give them that time? Like, what are your suggestions?
That's such a great question. And I know that many parents feel the impact of not having even time for themselves, to even have time to sit with kids all at once, if anything. Um, I think, the reality
Right.
is just making sure we check in with all of them, just a 5 minute, or just making sure, because this is how most of us introduce. Did you pick up your clothes? Did you take a bath? And those are the ways we pay attention to them. You took a bath already. You do your homework. And that's not greeting. That's not even saying, how's your day? How are you doing? And the less we do that, stop, pause, and say, how are you? The less, as they get older, the more uncomfortable and awkward that is. What do you mean you're asking me how I am? You've never asked,
True.
So
That's
it's
true.
never too late to ask, by the way, but it will be a little bit harder, and they'll find it strange, but they'll find it strange usually if they're teens or preteens, and they'll be skeptical. But after you do it more consistently, they'll go, hey, you forgot to ask me about that, because they really like it. But in the beginning, they'll challenge and they'll push you to say, you're not like that. I'm not going to get used to this nice treating you, asking about me. So just be warned for that. I know I went a little bit ahead of myself, but I wanted to make sure that, it's with all ranges. We have to always at least check in with them. It's kind of like us. If we have someone, when we're coming back from home, from work, it's always nice. How was your day? How was the drive? Whatever it is, to say, I haven't seen you. Everything okay? Anything happened that I need to, because we've been separated? It's the same thing with our kids. How was your day? How was practice? Was a rough day, huh? And you don't have to try to fix it. That's the second thing. Don't try to fix it when you're really asking how it is. And I could actually mention that as maybe relatable to you, or to all of us, who with our partner, we say, oh, we had a rough day, and they try to fix it for us. And you're going, no, I just wanted to tell you how I was. So you don't need to fix everything, especially
I just
mommies
want to
and daddies too. We feel like we have to fix everything to take away the yucky feeling. Just say, oh, that must have been a rough day. Yeah, I can hear it. All right, what do you need now? And you go, I just need a snack. Great. Or I'm just going to rest a little bit and watch something. Okay, yeah, you've had a rough day. So acknowledging it, and then they'll go, wow, you really care. And you don't feel like you have to intrude. They don't feel like you have to intrude on their way of dealing with it, which is something that's just kind of normal everyday thing. So that's also a very important part when we do give them that little check-in. So that's something that we try to do, and it could be when they come in, it could be at bedtime, before, just a little bit of that little time, and that's 5 minutes. That's all we're asking. Now, the other part of one-on-one that I think is very important is to ask, to just give, sometimes just say, on Wednesday, this is my 12-year-old child daytime. It could be 30 minutes
Mhm.
of just their time. So you arrange things that
Right.
could be, or one Saturday, it's for, just your 30 minutes of whatever you want to do. We can go to the park, we could walk. That it could be that time, and you could even call it a special time. You can say, it's M&N time for me. That's your initials and their initials, or so they feel like it's their
Yeah.
special time. Hey, mom. Hey, dad. Are we going to our M&M time today? Oh yeah, we forgot. Let me make sure everything's taken care of. It is our time. So it's really like if you were going to a very, very special appointment. that you need to go to,
Mhm.
and you don't make any exceptions unless there's an emergency. That is how they show value for them, because we do, if we have to go to a
Good.
doctor or something like that, we definitely try never to cancel unless it's an emergency. So for our children, what you're really doing is you're preventing them to have to go to a doctor in the future, because you're giving them that quality, that nurturance. You're feeding them what they need inside, as best as you can.
Good.
So that's something really important when we're talking about one-on-one, but it doesn't have to be every day, lengthy, but it could be, but at least if it's once a week, depending on how many kids you have, or it could be once a month, whatever it might work for you, make it reasonable so you don't fail. Parents don't, we don't want to set ourselves up for failure, because that's bad.
Good.
And things happen, so we can make exceptions, but for the most part, it's something that we could, that's foolproof in that sense.
That's great. Oh, I love that. And I love what you said about it is our tendency to we try to fix things, but I love how you reminded us to listen, and then you ask the question, what do you need? Because I think I jump straight to you need this, or you need this, or let me give you this, or let me give you this. But just asking them gives them opportunity. Again, my oldest is 4, so I have little people, but even my 4-year-old, she can articulate sometimes, or even if she doesn't know what she needs, having her talk it out is an opportunity for her to express herself and to connect with her in that way. So that's such a good reminder. I love that. What about and I know a mom too that she does a weekly date with her son, like a 1 hour thing on a Friday, and he gets to pick what the activity is, but that time has been so special and meaningful for them. So and you spoke a little bit to this, but when we finally find alone time, like what are the suggestions of things that we should do during that time?
Yeah, that's important. Really, it's dedicating your time for them. So you're not orchestrating what you
Mm-hmm.
want them to do. I mean, I've had parents that I say, if they want to play with the blocks and they're going to be putting the blocks that they're going to fall, if they don't ask for help, that's okay. If they ask you, hold it for me, don't say, well, you can't go too high. Remember, just allow them to manage that time the way they want. If they want to color with purple and yellow and green and zigzag all over the place, if that's what they enjoy and they say, look how pretty, it's a dragon. And you're like, okay, it's not at that time is not teaching. It's nothing. Let's do
Yeah.
circles. That's our need. Make sure they're advanced. Make sure they know their colors. We're always thinking so ahead, and they feel that they feel like they have to
That's great.
perform. So you have to, again, that word pause. Just pause and say, what do they need from me right now? And it's just your presence and your full attention. So there's no phones. There's no distraction. It's your special time, and that's really important, because even phones are distracting us all, especially moms and dads that are connected with either work related after hours or with kids, so we have to see a way that we could put it where it doesn't distract us, as much as possible, as well, as long as it's safe. But
That's right.
it's really, for me, it's just saying, just be present, just enjoy. And if they say, let's do a tea party, just let them manage it. And it's a beautiful thing. Now, this is for little ones. Now we're going into the 10 or even teens. Allow them to say, hey, yeah, let's go. Teens are really interesting because they kind of want you, but they don't, because they're individualizing. So they're like, I like you and I need you, but hey, don't get too right, right. There you go. So you have to play it and say, hey, you just want to let's have popcorn. Let's get your favorite treats at the store, and we're just going to watch a movie. They like horror movie, whatever it is. You don't start going horror movies, but that's terrible for your brain, or this one, you have to join them because they're going to do it anyway. So you at least will sit beside them and watch what they're watching and going, wow, I thought it was scary, but it wasn't as scary. Or how did you manage to get through that with your eyes open? I had them closed, so they actually will feel like, hey, I'm helping mom or helping dad, going, yeah, you see, I do this. And then you hear how they cope with something that and at least me as a psychologist, we see everything too much. We're like, oh my goodness, their brain's going to go this way and that way. No, just allow them to hear you. You hear them, and you eventually will say, wow, they know how to cope with this. And it's great. Actually, they probably shared something that helps us, they say, relieves our anxiety. So I think that's really important, with different ages, what they like. And the biggest part is for us to pause and not try to do anything trying to make it them performing perfectly or learning something, unless they ask, hey, I want to talk about this. And you go, okay, tell me about it. What is it that you want to talk about? And again, very active
Right.
listening is the most important
That's
piece.
good.
Just listening and acknowledging how they're feeling.
That's
And unless they say, what do you think I should do? You can say, let's think about that. What do you think you could do? Try not to problem solve, try not to fix anything unless they get, I'm really stuck.
mhm.
But what you're also doing is helping them say, I trust, and I trust that together we'll figure it out, but I trust that you've got it in you to figure it out. I'll just help you with it in the process when you want.
Good. That's empowering them. I love that. That's such a good reminder because I'm sitting here. My first thought was like, oh, yeah, I'll tell my daughter, like, let's go clean your room together or let's practice your letters together. And I'm like, that's me choosing the activity versus giving her that opportunity to say, what would you have, let's special time with mommy. What do you want to do? And giving them that autonomy to lead in that way. That's a good reminder, Dr. Benitez. Thank you. Okay, tell us, you mentioned earlier that temperament of a child and a parent really can play a role in sibling rivalry. So let's say, for example, one parent finds they have more common interests with one child, maybe more than the other, or that they have a different temperament from, another child. They could find it easier to relate to that child, to one child over the other because of this simply. Like, what advice do you have for parents who are having a hard time relating to the child or children that they have less in common with?
That's such a great question because it happens so often and it's a painful reality. And some of us are not even aware. Some parents are not even aware that they favor one. They're not even aware that they go out of their way to either see them perform if they're in sports or anything like that, or even trying to in terms of comparing, always seeing the good of, and then the other one's minimized. And it's just because it's either they can relate because they have the
Right.
same interest, or they have the same temperament. One likes to just read and just watch documentaries, so the little kid enjoys that too, and so all of a sudden spending so much quality time. And then the other one is kind of the jumping jack one, all over the place, or jumping bean. And so it's
Right.
like, oh, would you stay still for a little bit? And so all they get is like, be quiet, be quiet. And then there's a sibling rivalry because it's leave us alone. And there you go, the separation. Leave us alone. Daddy and I are watching this, or mommy and I. And so there's like, oh, they don't love me because I'm not smart or I don't like these things. So that's very important. And what we really have to do is have to get out of our comfort zone. The reality is first becoming aware. The kids will always tell you, he's your favorite or she's your favorite. And you're going to say, oh, no, no, it isn't. And they go, they know it because every single time you do these different things that are a little bit more special or out of your way for one over the other, they'll know. And so you have to see if they're saying that to you, or even if your significant other is saying, you need to listen and say, you may need to get out of your comfort zone, and you have to, they're your children. And even though it's harder for you to understand one that likes to be jumping all around and you're like, really like to just watch TV and be a couch potato, you have to say, what can I do? And it's either probably going outside and watching them jump and say, okay, let's throw this, and have that special quality time. And even asking maybe, what was that like yesterday? Something that makes them feel a little bit special. So we have to go and get out of our comfort zone and know it's uncomfortable, it's difficult. But the effort is, something that I think if any of us would acknowledge now, that one of our parents could relate easier with us than the other, just because either gender, same interests and things like that. But the effort that the other parent did made a big difference, even if it wasn't as much as, but there's a difference because they had a little bit more at that piggy bank, emotional piggy bank, what I said. How much money, how much emotional piggy have you put into your piggy bank for that child?
Good. That's good. Yeah. Often I feel like we're going and we're just making withdrawals, like clean your room, do this thing, all the chores or whatever we need them to do. But it's so important, like you said, to put those deposits in. That's so good. And a reminder, like you said, to look at our own situation, that we can probably look back and go, yeah, maybe I connected more with mom or dad or whatnot. And just to be mindful of those things, because sometimes, like you said, we can just be unaware. So tonight is just drawing my awareness to this, saying, okay, like these are good conversations to have with my husband so that we stay aware in dealing with our children. Dr. Benitez, I know one of your specialties is, children with chronic illness and children with disabilities. So I want to ask you, many parents with a child who is disabled or with a chronic illness can become concerned about how that could affect their other children. Can situations like this, can that create sibling rivalry? And how would you address, I'll say a two-part question. So that, but then also we're receiving questions in our question box as well on this topic of how do we address the different levels of attention that kids receive, and promote understanding among our other kids. Like, how do you celebrate one child's success without making the other feel jealous, which is a little bit of a different topic. But so talk to us first about maybe a child who is disabled or with a chronic illness, and then spend some time talking about how do we celebrate the successes of our children without making the other one feel jealous.
Yeah, those are really good questions. And there's such reality also that we'll have one child with some disability, and they do tend to need more attention. And then the other siblings will feel neglected, become parentified, and also feel like if they ask for something extra, either they feel the impact that they are putting more burden, so they remain more reserved on what they need. They actually shut down more and not aware that they need these things. And sometimes when parents are so stressed, and then the other children ask for something, they'll go, they'll have a very reactive response, which is, I'm exhausted. Don't you see that I've been, from one doctor to another doctor, or I have to take your brother here and there, So their parents are, in reality, extremely stressed out. And then the other child just wants one thing. Can I go to the store right now? As simple as, can I go to the store? I forgot my notebook, or I want a t-shirt for the t-shirt day, And sounds like it's the worst thing you could actually do, because it's one more thing. And so they learn from that. So parents need to know and be able to tell the children when they're seeing that there's a lot of time spent, is to really acknowledge and tell their other kids that we have a family member, we're a team. One of our team members is having some difficulties, and together we're going to help them to become more independent as best as we can. That's why I'm taking him here and to the doctors. But I know that sometimes you don't get to spend so much time with us. So we're going to come up with a plan to help to make sure you are being taken care of. And that goes to, we make all efforts, for instance, making sure that if there's an activity that they are either a special dance or a football game or something like that, make sure that at least one parent makes all the arrangements to be there for that child, and take turns, because as best as you can. And again, I'm also talking about an ideal world where there's two parent families. Some, a lot of our parents, only have one. And I also want to be realistic about that is also very hard. So I want to make sure that I'm also being sensitive to that. And it is hard. And I think the biggest thing we could do with those realities is to acknowledge, to make all full efforts, to keep an eye on the other children, and also to get help yourself as a parent, because that takes a toll, being torn into so many different directions. It's not easy, but it's not easy to be a parent, as we've learned, as we have millions of books and needs, right, on how to be a parent. But also when there is a child that's having much more higher needs than expected, that takes a toll on everyone. And so we have to be very aware of that. Did that make sense, Yara?
Definitely. And forgive me, but I'm going to ask, because you said a word and I said, I don't know what that means. But you said that early on, you said that children could become parentified. Can you, what do you mean? What do you mean by that?
That's a good. Thank you for asking. That's when one of the children's become the parent of the other kids. So they're 12, 10-year-old, and mom and dad are taking care of the other kids. So they start picking up, cleaning, taking care of the little ones, making sure. So they become a parent. So they're parentified. So their childhood is missed out. So they don't ask for the usual of, let me go over someone else's house to spend the night or just spend the Saturday playing, because they have to take care of their siblings, be it old or young, that they have to, or they have to stay at the house to clean up because the sibling missed made a mess and they have to clean up while the parent is taking them to the doctor. So that's what parentified child is, and
Okay. That makes
we do it
sense now.
often, and we have to be careful.
That's good. That's good. Yeah, that can creep in. And yeah. Wow, this is such great information, all of this. Again, those of you listening, remember these will be recorded so you can reference them in the future, share it with a friend. Also, if you have any specific questions, drop those in the Q&A box. We will do our best to get to all those. I'm working my way through. So another one. Okay. Dr. Benitez, what we just spoke about, it can similarly happen when one child is gifted. So how do we address this to minimize sibling rivalry? And is it okay to allow like a little healthy competition between our kids?
Oh, that's great. Yeah. So when we have a gifted, we have to acknowledge that we all have strength, and I think we all have strength and we all have challenges just in general. But sometimes it becomes much more obvious when one is very gifted and the other one just, struggling or within normal, average, but has to study in comparison. So we have to make aware of this happens. So you don't want to undermine and make the one that's gifted feeling uncomfortable, or also not the other one that can't. So we just have to say, some of us come with these strengths. He happens to come with his strength. And then we say, I suggest for the parent to say, I have these strengths, and then your father has these other strengths, and so we work with each other, because I don't have, we can't have all strength, so we know how to work with that around. So make it more natural and normal, and say, we just work with each other and how to help each other with each other's strength, and sometimes even say, and I have this weakness, so that they can see you're human and that you've overcome them. And that's okay too. I think in terms of competition, I'm glad you asked that question. There's a couple of things that happens often, and it's so natural and it comes so early on. Two things: that we label our kids, or we think that competition is healthy, and we live in a competitive world. So those are two main subjects that I want to address. The first one is in terms of labeling, comparing. That's probably one that we are more comfortable with. We label our kids as, oh, he's the smart one. Oh, this one, he's the wild one. And, oh, this one, she's so prissy. So what happens, and we do it automatically, and everyone does it, but what happens is we start categorizing them in these little boxes, and they, all of a sudden, whatever it is, be it good or bad, they start kind of growing into these big boxes, and it's bigger. And then they're going, I can't even get out of this one because everybody expects me to be a certain way. And it's really, really hard. And I'm sure that many parents right now listening could remember what they were categorized as and boxed in, and maybe even feeling like, why do I always have to be the good one? Or why I was wild because everybody expected me to be wild. So why would I stop? Nobody would believe me or think I was sick if I would stop, So we have to be careful what words we use in reference to that, and then so that makes that's one of the don'ts, try to hold yourself back. What you can do in terms of even regarding the process of making sure you acknowledge their strength, just say, hey, you took, for instance, you said about report cards. A lot of competition is, for an example, one would say, look, I've got the B. I finally moved my math from a C to a B. Look, and all happy. And then the sister comes in and says, straight A's. There you go, mom. And then that B became nothing to this child, So we have to go, yeah, right. It's all like, oh my goodness. So we have to go and say, you know what? B is very good. I'm going to go, and right now we're not in report card competition or contest. What we'll do is I'll take some time with you, and we'll look at what your efforts were and what's important to you, what you've made. And let me look at you. I'm going to talk to you now and talk about your report card and how hard you worked to get that B. And so you acknowledge the effort. You don't make them smarter or compete and say, stop doing that. Your brother just got a B. Don't you see? So making her feel guilty for being smart and working hard. She goes, oh, that's not, so it's really delicate, but I think if we describe the process, which is great effort, you persevered, you really worked hard, and you're really being consistent with what you're doing. So you're just not labeling them, but you are actually acknowledging some qualities that they probably didn't know they had. And that's what you want.
Oh, that's good. I saw this in my house at work yesterday. My daughter was coloring and she said, I color even more beautiful than he does. You know, my 2-year-old, of course, he's like still learning how to color. But I thought, whoa, here it already is beginning at this age. Like they are comparing, you know. So like you said, drawing attention to the effort that both of them are making. And you know, we talked about, well, yeah, let's encourage him because he's still learning and he does great to be so much younger than you. He already knows how to hold the pencil or whatever, you know. But that's good. Those are good reminders. And I think probably everyone listening is going, okay, what have I said to my kids lately? Like what box have I unintentionally put them in? But that is really, really good tip to be thinking of, just a soul searching activity, you know, to what are we speaking over our children? This is really, really important. Dr. Benitez, so many questions. I want to keep going because we've got more questions coming in. Are there common mistakes that parents make when they handle their children's fights? So kids are fighting. What are the common mistakes that parents make in trying to deal with it?
Yeah. So I earlier said that we get involved too quickly. We try to fix it, stop it before we give them the opportunity to solve it themselves. So not knowing when to get in. Um, Also trying to, again, back to the labeling or boxing them in is like, he's the little one. So we protect the little one. So how dare you hit him? So without seeing the whole scenario, we're already blaming the big one for hitting the small one, and we may have missed the fact that the little one was bothering the small one, the bigger one that wanted to just want to watch something, but we see the end result. So one of the biggest mistakes is that we go in and discipline what the last action without really looking at what could have occurred. So we need to look at, say, okay, if it gets really bad, is that time apart, give us a few minutes here. I'll hear what's going on. When we're ready, when we're calm, and then we're going to come up with a solution to solve this. So you're not going in and solving it for them. You're not going in and punishing. Now, if there's hitting and things like that, there are consequences, and that's something that we could take care of, prior. That's some of the things that we need to do as parents, is to set some guidelines and rules of what would be consequences for hitting. And it could start as young as 3 and 4. When you hit, it's time out. Give them a space and say that's not allowed, showing them there's a different way if you want something, and then you have to learn to teach. So time out in itself for little ones is not just taking them away, it's giving them the tool or the skill that they are going to learn. And it's a process of learning, like we all learn how hard it is to walk. It's also a process of not grabbing or hitting or kicking when we're mad. We forget that. It takes a while to learn skills. So at different stages, you want to implement skills. I think the biggest skill you want to remember is problem solving skills. What you would give to your child when you get involved is to say, we have to figure this out. How is the problem solving? But we cannot use put downs, name calling, no arguing. When we're calm, we can talk about what happened and how we can fix this, And so those are some of the tips that could help the family kind of when the parent can get involved and to what degree to get involved, I think prior to that, families need to figure out if they're spending enough time as a family to bond. I think the more we bond, having a happy time together, then we're less likely wanting to really get mad and let the rivalry get to a degree that they don't like each other at all. They don't have anything in common because they're all so siloed, so separate. So that's another piece of prevention, and also going, I think I need to do this because they're fighting a lot more.
That's right. That's good. Yeah. And that was one of my next questions was, what can parents do every day to prevent fighting? So I hear you saying just spending that quality time all together so that they like each other. So we all like each other and get to spend time together. Is there anything you would add to that?
I think, I think it's spending time together, or at least an activity, making the effort of, if you're seeing and fun activity, but also, finding let's do a fun activity and let's learn something, like another day that we kind of learn what it means to be part of the family, teamwork, or what does it mean to be brave or honesty. They can bring some of their values, or even say, what is the value of our house, of our family? I have families that they create certain kind of design to show their names and what they value as a family. And that kind of gets the family together to bond. And so when we're off our value or our core, and that helps them get together. And so those are activities that could be fun, but also activities that are to bring the family together and bond them more. So there's different types of activities. If you see the fighting too much, or you're seeing the quarreling too much, it's also time to do family meetings, maybe that is once a week, and kind of getting together, that they talk about, okay, with certain roles that we have to have, so that they can start talking about what's really going on, and how we can help each other, because it is a team. And that's where the family, the parents, will take into the fact of talking about their values, what they want, and how they can get there, and making sure the family is all together in those value systems.
That's great. Oh, I love that. So important. It's just so much we can do on the front end to prevent. But granted, these things will happen. We know. Let's talk to us about, at what point do parents need to intervene when, there's conflict and when there's rivalry? Like, at what point, when do the parents need to just really intervene there? I mean, I assume, like, if things get physical, like, talk to us about that.
Yeah, I think it's really when we hear, the name calling, when you hear that it starts to be more abusive, where it's the same teasing. Sometimes we can even call it bullying. And it could be going both ways, but they just don't know how to get along. One starts one fighting. They don't know how to communicate. They don't know, like I said earlier, they don't even know how to initiate play. They just say, if I get this, at least I'm entertained with him hitting me. I'm running around. He's throwing something at me. They're entertained. They're not realizing all they're asking for is play. So the parent would have to look at that and teach that lesson. But when to get involved is when you hear the yelling or anything in terms of that, it kind of starts getting to a degree that they may hit something, break something, or threaten. That's when it's really something the parents need to intervene. Prior to that, like I said earlier, you want to resolve, but you want to hear that it's not happening again, that they're resolving it, that they don't hear the same pattern where it's now getting, I think it's like by degrees, there's always going to say, oh, she took my brush again. I told her to leave my hairbrush at my bathroom, those are things it's private, your property, so we go in and, start seeing if they resolve something, and say, maybe we need to talk a little bit about respecting people's private property, things like that. So you just have to hear it, but you don't have to intervene at that moment. You might want to intervene later on when it's calmer, because if you intervene there, then you're going to be the bad one. Leave me alone. You always take her side. You see that? And so that becomes a big issue. And you're like, well, I thought I was going to fix it. Remember, we're always thinking we're going to fix it. Yeah. Not always good. Only intervene if it's you know that it's going to get worse. And we all know our kids, and we know their level of anger. And so we need to intervene when we know it's okay, it's getting out of hand. This is not play fight. This is not just an exchange of frustration. It's beyond that.
That's good. Dr. Benitez, I've received a couple questions from our audience, and they're a little bit specific. So let's see if you can offer some encouragement to them. One is a mom who has children, they're ages 11 and 12, and they've recently started to get physical, which is breaking her heart, I'm sure. And you mentioned, consequences for when things get physical. What would be some good consequences for this age range? They're 11 and 12.
Yeah, that's hard. They're older, they're bigger. I think, and she's asking for consequences. Is that what she's asking?
Consequences for, I think they're getting physical maybe with each other, the siblings.
So yeah, so obviously that's the way they learn to resolve. It's just that they're getting bigger and stronger, and so now it's getting more scarier for the mom. I think obviously it's to try to set them apart for the moment. Try to stay calm as possible, and say, this is not allowed in this house. We need to respect each other bodies. We're not allowed to hit. We're going to have some time away, and it could be just 20 minutes apart. You go one place and the other. And then when we all are calm, because mom also is very upset, we need to talk about this and come up with, and I think the biggest thing is to come up with the consequences together. This is not something that we want, and in some families, we tend to be argumentative ourselves. We tend to be yellers. We tend to get angry and get stressed out and also, lose it. And so kids are modeling us, but the problem is that they're little ones not knowing anything else but what they've learned. So we learn to go, oh, we lost it today. And we know how to calm it down and say, that's not okay, And so we manage it more often, but they won't. They'll pick that up. It's very easy. It's an instinct that we have to be angry and outburst. We control it as we get older, but if we don't, so we also have to reflect on ourselves to say, what may I be doing to elicit this, or to maybe I react too much, or maybe not. You've never known how to intervene, where now it's getting out of hand. So there's different reasons for this. I'm just giving you different scenarios for that mom, and she just needs to work together with them and say, let's come up with a plan when this happens. First, to see what can be happening, what might be the causes, and then what will be the consequences when they don't use some of the skills that we say, which is, if your brother's bothering you, or if you're too tired and he wants to play, what can you do to prevent it before it becomes a fight? Because both will have the consequences. And that's one of the things. Both will need then the timeout or loss of privilege.
That's good. That's good. Thank you for addressing that. Here's another one. Back to when we were talking about time together and, giving one-on-one time to each child. One mom is asking that, she loves to spend time. She's got a preteen and a teen. Okay. So she loves to spend time alone with the older one, and the older one loves that. And so she offers that same opportunity to the younger one, the preteen. But when she really wants to have that time together with all of them, but the older one doesn't like that. She doesn't want to do the time together. And she says, you love her more than you love me. And it's hurting this parent. I mean, clearly, it's affecting her very much, she said. So she's just wondering, like, I'm trying to be equal with them both, but how can I do that? She wants them to be able to spend that time together. Any advice and tips you could give her?
Yeah, I think that's where a great family meeting should take place, kind of to look at and also be reflective for her to see what is it that we're doing, that we're promoting isolation, kind of just separate each other. And it could have happened just because of work. There's many reasons what happened, but it's becoming aware of it and saying, what can I do differently that I could join the family together? And it could be just 10 minutes on Thursdays, at 10 minutes, we're just going to meet together as a family. And we can just try to say something very, minor, which is, let's just talk about some of the rules, in terms of what we want at the house, or something simple. And that's kind of like a superficial thing. She may want to be a little bit more elaborate and say, I think we need a family meeting because this is hurting me. And she has some rules about, I want to explain how I feel, my wishes as a family. I want to hear what your wishes as a family is. So also that communication of, what do you view this family? And then mom is the one that really will promote then, as a mom, this is what I view our children. And this is what my goal would be. And so kind of coming up with a goal and how to get there. And then hopefully that means maybe spending 10 or 15 minutes on Friday something, or Monday afternoons, where it's that they can spend together. It could be just starting 15 minutes together, and not to expect going out to shopping or something. Very simple, small steps.
Right. I love what, and you said this early on back when we first started, but that simple, achievable, we kind of set out to go, I'm going to do a day date with my child every week. And it's like, maybe that's not where we need to start. Maybe a simple 10, 15-minute window a week is something we can all, aspire to. So that's great. Thank you. All right. We're just under about 5 minutes. A few more questions. So talk to us about, how do we cut down on, like, the older child always wanting to tell the younger child what to do? Because anyone who has an older child and a younger child has seen that in action.
Yeah, that's amazing that they become so powerful, and they want to dominate. They want to show how they're stronger. I think we have to take them aside sometimes and say, I know you have so many skills and you want to share it. So you don't want to make them look bad in any way. You want to protect them, but you have to take them aside and say, I see that every time I try to discipline your little brother, you come in and just kind of chime in and say more and things like that. I thank you for wanting to help out, but I think that's not your role, so setting some of those limits, but acknowledging the good in it, the effort in it. And I think those are great attributes or qualities to have, but this is how I would like you to use those. And I'll ask for help when I need to, so setting those limits, but putting it aside, not in front of the other child, because then all you do is create conflict right in front of the other ones and sibling rivalry.
Oh, that's good. That's good. Oh, there's so many questions coming in. I really don't know that we're going to be able to even get to all of them. There's so many good ones. What about what role, and maybe Dr. Benitez, if you'll give us an extra like 5 minutes, we can try to squeeze a few more questions in if you're willing. But tell us what other role or what role can other members of the family take to help decrease sibling conflict? Like maybe your grandparents around or an aunt or uncle.
Oh, that's so wonderful because, the grandparent or the aunts and uncles come in from the sidelines and they have their own different views of how siblings should be and how a parent should react. And it's really hard for a parent when we have so many. It's great to have the extended family, but sometimes they have different views, and that's where they reinforce something that we're trying to stop doing. So we have to teach them, if we're trying to stop comparing, stop labeling, we have to teach them this is what we're doing. And so a perfect example is, one of the things a lot of our parents think is we have to be fair with everyone. And fair equals equal. That means if I buy a pair of pajamas, to one child, I need to buy the other pair to the other child because it's equal. But maybe the other child didn't need pajamas. Why do I have to buy something? But what happens is that you bring it to one of the girls, and then the grandmother or the aunt is back there and goes, why didn't you give it to him? Don't worry, I'll get you a pajama. And the mom's going, no. So the mom has to say, she's okay. She doesn't need the pajamas. She knows that we're good. We good, right? So that right. Knowing that the mom will take care of her is so important. But that comes with showing that when she needs something, mom will go or dad will make the effort of going and getting that item or whatever it is. So I know it's needed sometimes to bring things, but as they get older, they have to learn that it's as necessity, what they need, So that's an important piece. And then it's also telling the family members what they need, what we're trying to instill in them, which is saying, look, he's running faster, or he's making efforts, he's really working hard or persevering. Things like that is important in terms of quality, which is hard, by the way. It's not very easy. All these things I'm saying is to become aware, because it's easier to say, wow, he's faster than everybody else in the family. And then, oh, there we go again. That's okay. We can make those mistakes, but as long as we're aware, it's also important.
That's good. Oh, it is good. Yes. Thank you for saying that. Because hearing you say all of this, I'm reminded, like, she's a professional. She's had 3 decades of study and experience practicing these things. I've been a parent for 4 years. I have so much to learn, but this is all, they're just helpful tools for our tool belt. And sometimes we're going to get it right. And sometimes we're going to, make mistakes, but that's even what we're learning here. It's like, we admit that. And it's gone a long way with my own children. If I've lost it in a moment, to sit down with my daughter and say, mommy needs your forgiveness because mommy got upset or, acted in a way that we don't behave like that in our family. So it's so good and encouraging. I feel like we're going to need a part 2 of this because there's so many questions coming in. We're going to take just a couple more and then we're going to wrap it up, but talk to us about how COVID-19 and quarantine has probably affected sibling conflicts.
Yeah, well, one of the things about, again, in terms of sibling rivalry is also the closeness. Just think about it. Sibling rivalry occurs because we're with someone 24/7, someone that we didn't ask to have, by the way. It's not like we picked them as my sibling or the timing. So we're always in close proximity. And I'm just saying that, pretend if we had a friend, because they say, my brother should be my best friend, that the kid next door I want to live, he's going to be my brother. have them live in your house for a week, and you'll see that they're going to be competing, fighting, and everything else. Because when we're together too long with someone, they irritate us. Yeah, it's just normal. We're like, we need
Yeah.
space. We all need space, right? So imagine when that's why sibling rivalry is so normal. But imagine in COVID, when we don't have anything else to do but stay home and always be with the same people without any of our outlets with our friends and things like that. So it really has intensified. And I think we need to know that. And maybe even if we live in a small apartment and they have to share rooms, maybe give portions of the house they're designated. So this is your downtime, this is yours, and see if they can each pick. That becomes sibling rivalry too, when they go, I want that same little corner. But we have to be prepared to say, these are the corners where you're always there. This is your little break. This is your other little break. But making sure they have some space, because they don't have space because of COVID. They just feel too involved in everything, and so that gets to each other's nerves. So it just intensifies every conflict that they have. And for parents, I think it intensifies because we're also stressed. We're also doing a lot more than we're used to, and worried for many reasons. And so we don't have the time and the patience to think like this, to be creative, to pause, because we're running also in a different, our adrenaline is running really, really high. And so we're just acting and reacting because of survival mode. So then we're not as patient with our children. So we may be also intensifying the tension in the home. And we have to be very careful, and also knowing that we may need some help. We may need to say, hey, today I've had a rough day. You come over, or grandma, come over. You're more patient today than I am. Be with them for a little bit while I get some fresh air, or just take a nice shower, whatever it takes to relax a little bit. Because
That's
it's
good.
true, we are going through a lot, and we're, short fused, and our kids will see it, and it's our reality right now.
That's right. That's good. I have some friends that their husband and wife, and they have a code word that they use when one of them is feeling like I'm about to I'm about to explode, so I'm going to need you to take the lead here when the kids are, things get wild. And I'm like, man, that's a good little tip, just to stay in that communication even with your spouse, or call in reinforcements. Okay, we are 5 after, so I'm going to ask one more question, because I know this is in an area of your specialty and it's pretty specific, so you may not be able to go all into it. I do want to take a minute before I ask that. Dr. Benitez, if someone wants to make an appointment with you, because we're just seeing lots of great questions come in, do they need to be referred by a pediatrician, or can they reach out to your office directly?
I think it depends on their insurance, if if they need a referral. If they don't, they just have to call our Jackson line, the assessment center here, that they'll take in their information and their insurance to see if it's covered here under Jackson Behavioral Health Hospital. In the number, I don't know if it's
Awesome.
okay to say the number right now, but it's our main line at Jackson. It's 305
Great.
355
Perfect.
7147.
Awesome. That's great. No, we know that UHealth Jackson Children's Care and the whole system is great and available to anyone listening. So reach out there if you have more specific questions. But let's wrap it up with this, and then I'm going to ask you to share some helpful resources with us. But you have a specialty in dealing with families of children who have autism and ADHD. One of the questions that we received is someone has 2 sons, ages 4 and 6, and they're receiving behavioral therapy at home for high functioning autism and ADHD. And she says it feels counterintuitive at times, because it seems like the therapist maybe are like talking to them about their behaviors in front of them, and with the mom. So they both have anger outbursts and can become physically violent. So she just wants to know, she doesn't like that they can only get her attention if they behave well, because she's like, I feel like they just need attention. So how would you encourage her? I know it's a very specific situation, but do you have anything you would say to this mom?
Okay, so it seems like, if I heard you correctly, is the mom is saying that she's got a behavioral therapist at home, and then she describes talks about each of their children in front of each other, the kids
I believe
together,
so.
and they get
Mhm.
anger outbursts. Is that what I heard you say? Yeah.
Correct, correct. And she's saying that she doesn't like the idea that they can only get her attention if they behave well and if she just ignores the negative behaviors. Because she said, I feel like that this is how she's being told to address the behaviors, but she's like, I feel like they're crying for my attention, you know?
Yeah, I see now where that is. That is a behavioral technique, which is just reinforcing, teaching the technique of I will only pay attention to you when you do this effort of behaving this way. When you're acting out or on the floor having a meltdown, I will ignore you because that's not behavior to get my attention. So that is a very strict behavioral technique that is very hard for many parents, especially with kids with autism, because sometimes they don't know how to express themselves well. I wouldn't be able to say either or, other than, may want to talk to the behavior analyst to tell her how she feels so that they can help her understand it and give it a try. Because there are a lot of evidence that it works in terms of paying attention to the good, but it is very hard. It's a very hard process. And some parents can handle that, others can't, and I'll give you a really quick example of that. Some parents go through the sleep with little babies. You probably know that, where they have the child sleep and cry, and they let them fall asleep, and you're hearing them crying. The parents are can't go into the crib, can't soothe them, and they're in pain behind the door, closed door, and they're in pain and pain. Some parents cannot tolerate that sleep schedule. Others can, even though they're in very, very discomfort, and then it becomes successful. So it depends on the parent and their tolerance, but there are different techniques, but this one is that's helpful, and she may need to speak with the analyst to help her with that discomfort that she has.
That's great. Well, thank you, Dr. Benitez. Thank you for taking a little extra time as well. We went a bit over tonight, but finally, and I think we have some resources here on the screen, but if you have any, books that you recommend or experts that parents could turn to for advice on dealing with children with conflict, would love for you to share those. I see a few websites and resources here.
Yeah, the book that I really recommend is Sibling Without Rivalry: How to Help Your Children Live Together So You Can Live Too. It's very easy. You can get it in the library. You can get it free, or you can buy it, but it's very user friendly. And it really breaks it down to a lot of the things I was talking about in terms of, and they do it in a way that's very easy, cartoon sometimes and scripts. So it's very helpful. PBS for parents has a lot of different things for even the siblings are going through things, as well as for parents. So that's another great resource as well. They're all great. Child Development Institute, the ones that are there, is also a very good resource for parents. And I Love You,
Wonderful.
the
Well,
Purposeless is
Dr.
just a
Benitez,
book. I
thank
Love You,
you
the
so
Purposeless
much.
is just a very sweet, very childlike book about how mom will love each individual for their unique things. So that's to prevent favoritism. So it's
Oh,
I
I love
Love You, the
that.
Purposeless, because it's very childlike, but I thought it was so cute to help parents know how you can describe what you love about them in description, instead of categorizing them, but showing it by she uses the
Right.
colors for that. So it's a cute book.
That is great. Well, thank you so much. I knew you were going to be a wealth of information, but it's an overflowing well that we can't even get into all of it tonight. But thank you for your time. I want to remind everyone watching that in 2 weeks, we're going to do this again. Our topic on Thursday, April 8th, 8 p.m. again. So plan to join us, is baby noises. So we're going to have Dr. Audrey Ophir, who's been with us before. She's going to address all the baby noises that we hear our babies hiccuping, sneezing, irregular breathing. When you're a new parent, things that your baby, the sounds they make can be panic inducing, but we invite you to come and learn when is your baby trying to tell you something versus when are they just making baby noises. So that's going to be in 2 weeks on Thursday, April 8th. Again, all of these will be recorded and saved on jacksonevents.org. Families that are watching along, we just appreciate you, and a huge thank you to UHealth Jackson Children's Care. So I hope everyone has a wonderful evening. Thank you again for joining us.